Good afternoon, everybody. My name's Dr. Andrew. Welcome to this episode of the Chiro Couch. Now, today we're going to be discussing, can you have chiropractic after spinal surgery? Well, the answer is a yes, but there are some conditions to this answer, which I'll outline for you, because we hear GPs and surgeons telling their patients they can't have chiropractic care after surgery, and this is just not true. But here is the confusion. Now, firstly, a chiro would never manipulate a surgical site, but we can carefully treat around the site because there are 24 other vertebrae in the spine and there's a lot of other works that we can do. But firstly, we need to understand exactly your history of spinal surgery, and we have to look at the appropriate scans before and after the surgery to understand the problem and how the rest of the body works, and also how your body has changed after the surgery. Now, this gives us an idea of the scope of practice that we have, so we know what we can and also what we can't do. But here are some reasons why you should consider chiropractic care even though you've had spinal surgery. Now, the first one is recovery. You're going to use other areas of your body more while you recover, so we can look after those areas also. Number two is spinal surgery can result in structural changes. Now, depending on the tissues and depending on the type of surgery, there might be other concerns of stability of other areas in your spine. And this is where chiro can step in. For example, if you fuse one segment, other segments might have to work too hard. We can definitely work with those. Number three is if we understand why you needed surgery in the first place. For example, if you had an injury, those other problems from that injury might have been ignored because your spine took priority. Well, let's address those injuries now. Compensations. If you think about hip surgery, walking differently for many years can affect not just the hips, but also your shoulders. Chiropractors work really well on neck, shoulder, and upper back problems as well. Number five, your posture, work habits. You still have to deal with these things, so you can use chiropractic care for maintenance so that your other areas of your body don't need surgery too. And of course, lastly, we can choose different techniques. We can modify them. We can just be a little bit more gentle in and around those areas so that we don't aggravate that surgical site. And the first thing is if you are choosing a chiropractor, make sure you're choosing a qualified chiropractor that has got experience with post-surgical patients and also is willing to collaborate with your medical team. Make sure you also share your medical history. Provide them with as much information in terms of the type of history, the date of surgery, any follow-up care, before and after scans, etc. And obviously communicate openly. Through chiropractic treatment, you might experience some discomfort or concerns as you're going through the program. So be prepared to change your treatment plan, speed things up or slow things down if your problem changes. Remember, safety is the most priority with any of this type of stuff, regardless whether it's post-surgical or just general chiropractic care. So always follow the recommendations of your medical professionals. But lastly, at the end of the day, it's always better to prevent surgery than it is to have surgery in the first place. And it's one of the things that chiropractors do best. However, in some cases, you just can't avoid surgery, but chiropractic might be able to delay it for many years also. So if you've had surgery or you want to know whether you can prevent it, or maybe you'd like to get your body ready to have surgery so that you're going to get the best possible outcome, or lastly, you've just had surgery and you've got other problems and you needed those addressed as well, why don't you give us a call or a message and find out whether we can help you. My name is Dr. Andrew from Rabina Chiro Wellness Centre, and I'll see you next week on the Chiro Couch. Bye for now.